What is a lotus birth? If you're curious about the concept of a lotus birth, you're probably wondering what it entails and whether it's a safe and beneficial practice. Let's break it down. A lotus birth is a method where the umbilical cord is left uncut after childbirth, keeping the baby attached to the placenta until the cord naturally separates. This usually happens within 3 to 15 days after birth. The idea behind this practice is often rooted in spiritual or philosophical beliefs. Proponents argue that the baby and the placenta are connected on a cellular level, and some believe that this connection provides the baby with additional benefits, such as a stronger immune system or a calmer attitude. However, it's important to note that these claims have not been scientifically proven. When a baby is born, the placenta, which was once a vital organ supplying oxygen and nutrients, no longer receives blood flow and begins to decompose. This dead tissue can become a breeding ground for bacteria, posing a significant risk of infection to the baby. To manage this risk, parents who choose a lotus birth must take careful precautions. They need to keep the placenta near the baby at all times to avoid pulling on the umbilical cord. The baby should be dressed in loose, open clothing to prevent the cord from getting tangled or pulled. It's also crucial to monitor the placenta and the baby for any signs of infection, such as redness, swelling, or an elevated temperature. There is no standard or medically recommended way to store the placenta. Some parents keep it in a bag, while others leave it open to air or use herbs and essential oils, though none of these methods have been scientifically validated. It's advised to seek medical attention within 1 to 3 days after delivery, even if there are no immediate concerns. If you notice any irregularities, such as poor feeding, unusual sleeping patterns, or signs of infection, you should seek medical help immediately. In summary, a lotus birth involves leaving the umbilical cord attached to the placenta until it naturally separates, but it comes with significant risks, particularly related to infection. While some parents choose this method for spiritual reasons, it is not recommended by medical professionals due to the lack of scientific evidence supporting its benefits and the potential health risks involved.